Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
So guys, today I'm speaking with Dr. Phillippa Houghton. Phillippa is a family physician with specialized training in perinatal mental health, and we are super excited to be talking about perinatal anxiety. So Phillippa, I thought you're okay if I call you Phillippa? Dr.
Yes, of
Phillippa?
course. Yes, of course. I actually quite frequently get called Pip, so you can even
Pip?
go Pip, yeah.
Oh, I love that. Okay, so Pip,
Yes.
can you tell me a little bit about yourself and what brought you to the field of perinatal mental health?
Yeah, so I am relatively new to practice in family medicine. I'm on the island, on the North Island in Campbell River. I'm about a year into practice. I am actually on maternity leave at the moment. And during my residency training, I was pregnant with my first baby. And I was a bit gobsmacked when he was born. And there were just so many things that I felt like no one had prepared me for, let alone my residency training. I had done residency in family medicine. Babies and women and postpartum were supposed to be kind of my jam. And I just felt like there were so many things I just didn't know enough about. And it made me kind of start percolating on, well, if I don't know after 7 years of medical training, how can anyone else possibly be prepared for this monumental shift? And so I kind of developed a bit of an interest just in supporting women through their transition into motherhood, or sometimes you hear the term matrescence is kind of trendy at the
Oh,
moment.
yeah, I like that.
Which I love. And so I was sort of already in that mindset. And then unfortunately, a close friend of mine had a really terrible time with postpartum depression and anxiety. And she reached out to me, and sort of through supporting her, I realized that there was a lot I didn't know about perinatal mood and anxiety disorders. At least in my particular training, it just wasn't something that came up a lot. And I just felt really compelled to learn more so that I could, one, support her, and two, also support my own patients. And, ideally, I would love to be creating sort of content and educational resources that can support women all over the island in Canada and anywhere women need support, because, the thought of a woman suffering alone in isolation really does break my heart.
Oh, absolutely. On that note, tell us a little bit about your Instagram. What is your handle so people can find you and what kind of information you share there?
Yeah, so I am relatively new to the Instagram, Facebook content creation world, but my new handle is Making Mama Well. So I'm currently on Instagram and Facebook. I'm just in the process of developing a website as well. And most of my content is focused in that sort of perinatal mood and anxiety disorder realm, but also a little bit on matrescence, transitioning to motherhood, what to expect from postpartum. And some of that's physical as well, physical changes you can expect from your body in pregnancy, as well as in that postpartum period. Just because I do think there's a lot of things we don't share with each other as women. And, we often find ourselves sitting at home alone, wondering if it's normal to have pain when you're pooping, or to still have bleeding 4 weeks postpartum, or a variety of things. And I just think we need to talk to each other more, because mothers need other mothers.
Yes, absolutely. And before we get into it, I just wanted to know if you could tell us a little bit about the specialized training you did above and beyond your medical training in your family practice residency in perinatal mental health.
Yeah, so when I started developing an interest in this, I came across Dr. Alexandra Sachs online. She's got a great TED talk on
Yeah.
matrescence, which
Okay.
I will send you the link for.
Yeah,
And
we'll
so I
put
just
that in the
loved,
show notes.
yeah,
Yeah.
I loved her talk, and so I immediately bought her book. poured through her book, and I just thought, wow, I need to do this. And so I actually messaged her on Instagram and said, how can I learn more about what you do? How can I do this at the GP level? And she referred me to Postpartum Support International. And I discovered that they have a certificate program for health professionals. It's also open to social workers, nurses, lactation consultants, and there's a variety of pathways you can follow to get the coursework required to then write the exam. So I did all the coursework earlier in this year and was supposed to write my exam back in May, but then COVID happened and
Yeah.
everything kind of shut down a little bit. So I only just actually got my exam done 2 weeks ago, and I did pass. So
Yay.
yeah, so officially certified as a perinatal mental health provider. So it's by no means comparable to, a formal reproductive psychiatrist or someone with a, college level psychiatry training, but it does give me a little bit more training on top of family medicine to work with sort of mild to moderate perinatal mood and anxiety disorders.
Oh, it's such a huge resource. And I would encourage a lot of people to follow you on Instagram, because one of the reasons that Alicia and I started this was to make sure that there was, evidence-based, reliable content being shared. And with your expertise, I think you will be doing just that in this field. So
Oh, thank you.
I'm really excited that you're doing this. So today we're going to talk about pregnancy anxiety. And like we were talking about before we actually decided to sit down and do this podcast, when we talk about anxiety disorders, we talk about generalized anxiety as well as sometimes OCD, which can sometimes get confused with anxiety symptoms, and then PTSD. Are you able to talk to us a little bit about those diagnoses and how they might present and what to expect and what to look for?
Yeah, definitely. So, Postpartum Support International kind of likes us to use the overarching term perinatal mood and anxiety disorders. And that's sort of recognizing that, we once thought that it was really just postpartum depression and it only happened in the first couple of weeks postpartum, and that was it. And now we know that depression and anxiety, or anxiety disorders and mood disorders, really overlap with one another a lot. They, in medicine, we would call them comorbid. So it's very common to have both anxiety and depression to some extent.
Mm-hmm.
And then the other thing it's acknowledging is that these are really perinatal disorders. So that means that they can occur anytime in pregnancy and up to 1 year postpartum, but they actually can also start even before pregnancy begins if the woman is coming from a background of infertility or previous pregnancy loss. So it's not well understood even amongst my medical colleagues, through no fault of their own, it's just through the training we've come from, that these disorders can onset anytime in the perinatal period. So pregnancy up to 1 year postpartum, and even before pregnancy if you're coming from that background of pregnancy loss or infertility. So unfortunately, a lot of women that could be picked up really early in the presentation of these disorders get missed. And especially with anxiety disorders, we know that they tend to intensify over the course of the pregnancy, and typically don't resolve in the postpartum period. So if we're missing them in pregnancy, they're probably going to get worse
Mm-hmm.
in the postpartum period. And so if someone is struggling, whether that's in the infertility phase or pregnancy loss phase or in their pregnancy itself, I would really encourage them to seek treatment early. And unfortunately, I have heard from some patients that their symptoms have been downplayed by healthcare providers who kind of said, well, you're pregnant, you're a new mom, it's normal to feel worried, it's normal
Mm-hmm.
to feel anxious. And that is true to an extent,
Mm-hmm.
um, until it's not anymore, until it
Yeah.
becomes disruptive to your ability to function. And what really worries me is disruptive to your ability to enjoy your pregnancy and your postpartum, because those periods in your life are so fleeting. And if the whole pregnancy and postpartum experience is marred by this terrible anxiety, you'll remember that for always.
Yeah,
So
I know it's such a short time and it's such a precious time that if you're struggling with undiagnosed and untreated anxiety,
yeah,
it's devastating.
yeah, suffering alone is not worth it. There is help, and with help you will be well.
Agree.
So
So what are some warning signs that people should look out for in terms of anxiety, OCD? That
yeah, so risk factors for an anxiety disorder in pregnancy is pretty much the same as in the general population. So the first risk factor would be if you yourself have had an anxiety or mood disorder
Mhm.
in the past, you're more likely to have one in the future. And that applies to pregnancy as well. So if you've had a prior pregnancy impacted by a mood or anxiety disorder, you're more likely to have that in your next pregnancy, in your subsequent pregnancy. So, if you are someone who's had a previous mood or anxiety disorder in a prior pregnancy, and your conception planning, you're planning for a future pregnancy, I would strongly encourage you to seek out treatment, even if it's non-pharmacologic treatment,
Mhm.
even if it's counseling, even if it's social supports. Seek that out while you are planning for that baby. Don't wait until you are pregnant with baby number two.
Oh, that's like a huge pearl, right?
Yeah, and I think it's just not something we think about.
Yeah.
Or sometimes, half of pregnancies aren't planned, so sometimes these things just happen before
Mhm.
before we know it.
Mhm.
Stressors in your pregnancy or birth. So again, if you've suffered from infertility, if you've experienced a previous loss, if you've had preterm birth, if you've been a NICU parent,
Mhm.
military families, military moms are higher risk. Mothers with a history of substance use or misuse are all at higher risk of mood and anxiety disorders. A prior history of traumatic birth, sexual trauma,
Mhm.
sexual violence, those sorts of things all put you at increased risk. And sometimes there's no rhyme or reason to it. Sometimes it's just a combination of, what happened in your birth and your genetics and the circumstances. COVID is making things so
Yeah.
much worse for women right now.
Yeah.
So sometimes it's just unpredictable and it catches you by surprise, and it's not your fault. It just happens.
Yeah. I know. I think that message too is so important. Despite the fact that it's 2020, which is a terrible year, but the fact
Yeah.
that we're this far into the 21st century and we still have this much stigma around mental health, right?
Yeah.
Um, you know, I it's not your fault, right?
No, no.
It's a there's a huge genetic predisposition and then life events that we have no control over.
Yeah, absolutely. This year in particular.
Oh, right? Yeah. And then what about when it comes to anxiety versus OCD, are there any specific risk factors for OCD or any, signs or symptoms that people should look for if they think they've got one versus the other?
Yeah, so I maybe what I'll do is just break down the three anxiety disorders that we talk about in the perinatal anxiety
Yeah.
world. And they are crossover to the general
Yeah.
population. So the three disorders we talk about are generalized anxiety, obsessive compulsive disorder, or OCD, and PTSD, which is post-traumatic stress disorder. So generalized anxiety is a condition where you sort of have this pervasive sense of worry or anxiety about many things. And it can be really difficult to control. So it can kind of feel like your brain is on fire, or like your thoughts are always racing. It can feel very overwhelming or exhausting. And in the perinatal periods, often those thoughts and those worries are really focused on the well-being of the pregnancy, the well-being of the baby, and just a lot of worry around your ability to cope with birth or mothering, or aspects of the pregnancy itself. And this may be a new disorder just to the perinatal period for the individual, or it might be that they've suffered from generalized anxiety related to a whole different part of their life
Mhm.
prior to pregnancy. And now that they have found themselves pregnant, the thoughts have really focused on the pregnancy and the baby. So some specific symptoms to do with generalized anxiety are sort of that sense of excessive worry, difficulty concentrating or feeling like your mind is blank. And women in particular, which is not well talked about, it's common to feel this sort of edginess, irritability, anger, or even rage. And for women in particular, this can cause quite a profound sense of guilt and shame, which
Mhm.
then causes us to hide the
Mhm.
anxiety that we're feeling.
Yeah.
And so, if you're someone who's thinking, well, why am I feeling so irritated with my partner or my older children or my best friend or my sister, it might just be that you're struggling with some anxiety.
Mhm.
And that's not well understood. So that's an important thing that I like to express to women, is just watch out for those feelings of irritability or anger, especially when you can't pinpoint where they're coming from.
Yeah.
Feeling really fatigued, feeling chronically overwhelmed or burnt out. And then generalized anxiety often comes with physical sensations in the body. So there's often a thought and then sort of this feeling of anxiety, and then these physical sensations where you may feel like your heart is racing, or like you can't catch your breath, or like your head is pounding, or like you might faint, or even like you might die, like you might pass out and the world will end. And so those symptoms in particular are really important to talk to your maternity care provider about, because they do also overlap with some physical
Mm.
conditions that can occur in pregnancy, thyroid problems, or more serious conditions. So certainly if you experience any of those symptoms, please do talk to your maternity care provider, but it is possible that they are also related to anxiety.
Yeah.
And then what can happen with generalized anxiety is this thought pattern called intrusive thoughts.
Yes.
Um, and intrusive thoughts are these sort of images or thoughts of often it's something bad happening to yourself or to your baby. So in pregnancy, you may have this really vivid image of yourself falling down the stairs and serious trauma coming to your abdomen, and bleeding and losing the baby. And that in an anxiety disorder, that may be a fleeting thought that you're able to talk yourself out of, or it can become quite severe and pervasive and kind of blend into the OCD picture, which I'll get to in a moment. It is worth noting that some studies suggest that up to 90% of postpartum women will experience some level of thought intrusion.
Wow.
So
That's
it
so
doesn't,
high.
yeah. And just because you are having intrusive thoughts, it does not necessarily mean there's a disorder.
Mm-hmm.
And it does not necessarily mean there is something wrong with you, or like you're a bad mother, or that you want to act on these thoughts. And in fact, the defining feature of an intrusive thought is that you don't want to act
Yeah.
on it. So, these thoughts are very disturbing to you. You're trying to avoid them. You're trying to make them go away. And if you're finding you're having intrusive thoughts that start to seem like something you could act on, or that they're normal or that they're okay, then that's actually probably more worrisome and something you need to get help for urgently, because it is sort of a red flag for postpartum psychosis, which isn't something we're talking about today.
Mm-hmm.
So, if you are experiencing the odd thought of, what if my car suddenly veers off the road, or what if I drive my car off the road? That doesn't necessarily mean something is wrong, unless the thoughts are becoming very pervasive and really starting to disturb your ability to function, because then that's starting to blend into OCD. So with obsessive compulsive disorder, the women are finding themselves really plagued by these thoughts of harm coming to themselves or baby, and they're often described as these really vivid images of something terrible happening.
Mm-hmm.
Um, and these thoughts cause so much anxiety that it compels, so that's the compulsion component of the obsessive compulsive disorder, it compels the woman to change her behavior to either relieve the thoughts or avoid the triggers. So an example that I had a patient share with me is she had this thought every time she was going to get in the car that she was going to lose control of her vehicle. It was going to go careening through a red light, and she was going to have this terrible accident with her baby in the car. And that she was going to die, and that her baby would be terribly injured, but none of the bystanders would realize there was a baby in the car. And so
Mm-hmm.
baby would be left unattended
Oh.
and would die this terrible, painful death in the car. And this wasn't just a thought. It wasn't thoughts passing through her mind. She could picture every
Mm-hmm.
step of this
Mm-hmm.
image. And
Mm-hmm.
it would happen every time she even thought about getting in the car, to
Yeah.
the point where she stopped driving. And so she was a stay-at-home mom. Partner was at work, so she would not go to the grocery store. She couldn't
Mm.
get to doctor's appointments unless her husband took time off work. She was housebound by this one image of this car accident. And so that's sort of the hallmark of where the intrusive thoughts are becoming a problem or becoming a disorder, is that you're starting to change your behavior to avoid the triggers or to relieve the anxiety. Um, and you did actually have a few people ask that question, is when do I know if intrusive thoughts are
Yes.
normal or a problem? And they are a problem if they are starting to impact your function. So if you are
Mm-hmm.
changing your behavior, they're a problem and you need to ask for help. And there is help.
Yes. Oh, there's so much help, but it's so true. And I myself experienced postpartum anxiety and OCD, and my intrusive thought was all about SIDS. My baby.
Which is very common. Staying
So
up all
common.
night checking your baby
Yeah,
to make sure they're still breathing.
100%. I
Mhm.
remember like driving in the car, and he was asleep in the car seat in the back. And this was this old tiny Jetta, the last year of like the little boxy Jettas. And I was so obsessed with making sure he was still breathing that I woke him up. Like I was
Yeah.
like reaching back, you know what I mean? Like it was just, I could not check on him.
Yeah.
Right?
And
And
that's a very, very common theme
yeah,
in the
yeah.
intrusive thoughts.
Ugh.
And I'm sure what a lot of women are experiencing right now. is intrusive thoughts related to COVID.
COVID.
Germs
Yeah.
everywhere, hand washing, and, where are we drawing the line between hand hygiene as recommended by public health and hand hygiene being driven by anxiety and obsessive compulsive disorder.
Yeah.
And I think that's probably a very hard thing to discern
Yeah.
right now.
Oh, absolutely. I know people ask me all the time, do I need to wipe down my groceries? And I can't say yes or no what you need to do, but
Yeah.
I'll tell you right now, I'm not doing it.
No, neither am I.
Yeah. Okay. So we talked about generalized anxiety, OCD, intrusive thoughts, which is such an important topic.
Yeah. So please don't feel ashamed if you're having intrusive thoughts. You are still a good mom if you're having intrusive thoughts, but please ask for help if they are starting to disturb you or impact your function.
Yeah.
Oh, and I did also want to mention, because one of your followers did ask about mess triggering OCD. And I think it's really important to touch on this because it's a really common OCD trigger. And so mess can be a big trigger for anxiety in the perinatal period because as we all know, when we're pregnant and when we're postpartum, we have this very strong nesting urge, which is actually biologically driven. Mammals do it as well. You see animals creating their literal nest to prepare for birth. And this is driven by our biology to prepare our environment for our baby. And so it can make us hyper vigilant about disorder in the environment. And that can present as a need for tidiness and cleanliness in the home. And again, there's a line, right? There's a line where that's just nesting and where that's becoming a dysfunctional thought and behavioral pattern. But this one person in particular asked, how do they work with their partner to help them understand that this mess is really triggering? And I think, for a lot of partners, my partner as well, understanding that this urge to keep the environment tidy is actually a biological component of pregnancy can help them have a little bit more empathy for what you're doing. The day before I went into labor, my husband came home and I had taken the entire refrigerator apart and was cleaning everything. And he actually said, the baby must be coming soon because you never do this. And it is so funny. It's just this overwhelming urge.
Yeah. It's so true.
It's just,
our
brains in pregnancy do funny things to us.
Yeah. We actually talk about this a bit in the prenatal course that we put together. And I linked to this great article about nesting because it's really fascinating. And not everyone experiences it. And if you don't, that's okay.
Yeah.
I did kind of, but not cleaning. Like my husband probably wishes I did because he likes to be tidy. But I think it's really important for people and their partners to understand that it is biologic. And that if you have to deal with it, that's probably going to, put you at increased risk of anxiety or, if you're not able to.
Yeah. A mama's nest who feels disordered is not going to feel at peace in her environment.
Totally. Peace. That is the word, right? Yeah. That's what we want. And matrescence, is that
matrescence?
Yeah. We want it to be peaceful.
Exactly. Yeah. So the last anxiety disorder we're going to touch on is PTSD. So post-traumatic stress disorder. So this is unfortunately really under-recognized, and we don't have a good sense of how many women suffer from PTSD in pregnancy and postpartum. They estimate it's between 3 and 15%, but unfortunately it goes missed quite often. And so PTSD as an anxiety disorder in the general population is marked by sort of a cluster of symptoms where you have this sort of hypervigilance, you're feeling on edge, easily triggered by things that remind you of the previous event, the traumatic event. You may experience flashbacks, nightmares, or avoidance of things that remind you of the event. And that thing that reminds you of the event may be something really benign and not obvious. It doesn't have to be, that sort of movie idea of PTSD where the Army veteran is triggered by a gunshot. It can be something as benign as actually being triggered by a baby crying because you had a traumatic birth. So PTSD, if it's left unresolved, can persist into your entire postpartum period, and it can persist into future births. So, if you have experienced a traumatic birth, and also I did want to say that traumatic birth is traumatic when it's perceived as traumatic by the birthing person. And I think this is why sometimes it goes missed, is because the healthcare team may not view it as a traumatic birth. It may have been a fairly routine birth, or maybe there was, something that went a little bit off course, but wasn't terribly abnormal for the healthcare team. But for the woman, she may have perceived that as terribly traumatic. And so that can cause PTSD for her, and it may go unrecognized because the healthcare team may not have seen it as a very eventful birth. So if you are finding that you had this birth that did not go according to plan, and you are feeling a sense of trauma over it, it is really important that you reach out, and in particular that you seek out trauma-informed counseling, and that, counseling is helpful for any anxiety disorder, but specifically trauma-informed counseling is really necessary when you are experiencing an acute stress response or a PTSD sort of picture.
So if people are thinking they may have some of these, so they're pregnant and they may, relate to some of these, symptoms of anxiety or, PTSD or OCD, what are some strategies to deal with it, or, places to reach out and seek help? Because one of the questions I think was, some people, like, especially here in Victoria, and it's probably the same for you in Campbell River, that some resources are limited, but we're fortunate now. There's a lot of resources like PSI, Postpartum Support International. It's amazing. What would your recommendations be for people who may feel that they may have some of these conditions that are undiagnosed or diagnosed, but maybe not yet well managed?
Yeah, so I think the first port of call would be your family doctor or your maternity care provider. Make sure you let them know what's going on. And, if you feel you're not being heard, or you are kind of getting, well, it's normal to feel anxious when you're a new parent. If you know that what you're feeling is not normal for you, really make sure you advocate for yourself. Don't sit in isolation. So I would start with your primary care provider or maternity care provider. And then beyond that, there's lots of, private counselors who work with pregnant and postpartum women. I often direct people to the website fetch.ca, and you can kind of search what counselors are available in your area, and you can even read their little profiles and find someone who fits sort of what you're looking for.
And is that Canada wide, or is that just BC,
I think it's Canada wide, but I actually should probably double check before I say that.
No. We'll link it in the show notes below, but it's great to know resources are out there, because not all of us even know what resources are there, right?
And it changes.
Yeah.
Yeah. And then, like you mentioned, Postpartum Support International is a great resource. So they've got printed stuff that you can access and do sort of some of your own self-directed psychoeducation, which is really important. Psychoeducation just means educating yourself about what's going on in your psychology. And sometimes just having understanding of what's going on in your thought processes and your feelings is enough to kind of get you through a tough spot. But Postpartum Support International also has a whole series of virtual support groups, and they've expanded their series since COVID. So this is one of the upsides of COVID is we have a lot of virtual options that are free.
That's great.
So they've got groups for, NICU parents, pregnancy loss, infertility, transgender families, military families, like every, permutation of families, there is a virtual support group. And we know that social support and connection with people who are going through similar circumstances plays a huge role in recovery from mood and anxiety disorders. So that is a great resource, especially in a time where we can't go out and about in the community. Pacific Postpartum Support Society, which is Canadian and based on the Lower Mainland, also they've got a great website, and they have a helpline, but they do also have individual telephone counseling, as well as group counseling that used to be in person but is now offered virtually. And they offer counseling for the non-birthing partner as well, which is important. And something I didn't mention is that the non-birthing partner and fathers are also at risk of perinatal mood and anxiety disorders as well. So, they've got that resource for the partners available as well.
That's great, because I think that's something that we underdiagnose.
Absolutely. Well. Yeah. That's a whole other
podcast, right?
That's a whole other podcast.
Yeah. Coming soon to a podcast near you.
Yes, absolutely.
Yeah.
And then, in terms of talking about the non-medication options, I was going to talk a little bit about self-care stuff, but you guys just recently did a really great podcast going through the NESTS acronym.
Yeah.
So I'm not going to go into it in too much detail, except to say that sleep is so important if you are struggling with anxiety, any anxiety disorder. So if you are not sleeping, And I know it's really difficult. And I actually find it very annoying when people say sleep when the baby sleeps, because there's so many things we want to get done when the baby is sleeping, that sometimes feels a little bit irritating.
Oh, yeah.
But if it is nighttime and your baby is sleeping and you are not sleeping because you are lying awake worrying about all the terrible things that could happen to your baby, or your massive to-do list, or whatever it may be, if you are not sleeping at nighttime when your baby is sleeping, then you need to get help to get your sleep in order, because your anxiety disorder will not resolve if you are not sleeping. And so sometimes this does mean medication to get you back on a proper sleep cycle. Unfortunately, we do have lots of medication options that are safe in pregnancy and lactation. So if you are struggling with insomnia in pregnancy or postpartum, please talk to your family doctor. There are options available.
Yeah. We can do a whole podcast about that, insomnia.
Yes.
Right?
Yeah. Yeah, we should.
We should. Coming soon. Yeah. So many podcasts, right?
Yeah. And then social support is super important. That is part of your NAST acronym as well. But this is a really important topic that is close to my heart, because, in talking about that term matrescence, there's so much about new motherhood that is only understood by other mothers, and mothers need other mothers. And so, especially right now with COVID, again, it's really hard to connect with other mothers and with our social supports. And I think that's really contributing to the uptick in perinatal mood and anxiety disorders that we're seeing right now in 2020, because we're sitting in isolation, and mothers are not meant to mother in isolation. Parents aren't meant to parent in isolation, but we're, kind of focusing on moms right now. So I would encourage anyone who is pregnant, especially for the first time, to try and find another mother they can connect with, even if it's on Instagram or virtually. And if you feel comfortable, I often suggest to women that they ask this person first to tell them the best part of becoming a new mom. So what did they love? What would they do over and over again? What was that special fuzzy moment? And really take all that in, absorb it, and then ask them if they're willing to share what was the hardest part about transitioning to motherhood. And ask them to be honest, because we often aren't honest about the hard things. And ask them to share every detail if they're comfortable, and what resources they used to get through that hard period. Or if they didn't have resources at the time, what in hindsight would they have liked to have had to help them get through that tough time. And I'm not suggesting that we all become that just you wait friend who's, just you wait until you're not sleeping, or just you wait until your baby's doing this or your toddler's doing that. I'm not suggesting we go overload people with unsolicited advice, but I do think that some, sharing of experience, both the positive and, the negative or the hard stuff, can help normalize the transition to motherhood for the women who come behind us, so that we're not feeling like the only person. And I use cluster feeding because it was the thing that really gobsmacked me. I felt like I was the only person who was stuck on my couch island watching Gilmore Girls for 3 days and unable to move.
Yeah.
And then lo and behold, a dear friend of mine who is not medical, who was a few months ahead of me in postpartum, said, "Oh, no, that's just cluster feeding. That's normal. It'll go away." And we need those people. We need those friends who can say, no, that's normal. That's common. It will get better. This is what I did. So find your people.
And also the people who can tell you that's not normal, get help.
Yes, absolutely.
Right?
Yeah, of course. And that's so true, because often it is the other people in our lives who notice when things are not normal. It can be really hard to recognize in ourselves when we are not coping well. So often it is our primary relationship, or our moms, our sisters, our friends, who say, something's not adding up. We need to get you help.
Yeah. No,
so yes,
absolutely. I love that.
Are really important.
I love that. Those 2 questions. That's awesome.
I'm going to answer them at the end, because I thought I would start. I would get the ball rolling, and you can feel free to answer too if you want.
I love it. Yeah.
So I did just want to briefly touch on medication as part of the treatment plan, because you did get some questions through your Instagram about medication. So Postpartum Support International really likes their golden rules of treatment, and I love them. So their golden rules of treatment are: first, that every baby deserves a healthy mother. Second, every mother deserves to enjoy pregnancy and motherhood. And third, all exposures in pregnancy carry some level of risk, and this includes untreated perinatal mood and anxiety disorders. So when we're talking about using medication in pregnancy and breastfeeding, we are not just talking about risk versus benefit. We are talking about risk versus risk, because nothing is free from risk. So an untreated perinatal mood or anxiety disorder does carry risk of preterm birth, low birth weight, increased risk of maternal suicide, poor compliance with prenatal care. There's some suggestions that there's long-term impacts on the development of, cognition, behavior, stress response in the child as they go through their life. So, it's not treating your mood disorder is not a benign decision. It is also a decision to choose not to treat. So if you're in a position where your care provider is suggesting medication, don't over concern yourself about the risks of medication, because you might be unconsciously choosing risks of an untreated mental health disorder, which has risks.
Totally, right? Like the risk of the untreated disorder could be higher than the risk of the medication.
Absolutely. And we know, the class of medications we typically use in mild to moderate anxiety and depression in pregnancy and postpartum are the SSRIs or SNRIs. And we know that as a class, they're generally safe in pregnancy. There may be a few conditions where you might be on other medications or have other medical conditions that might exclude you from those categories. But in general, for the average pregnant or postpartum woman, they're considered safe. However, they do carry some risks as well. And so we know that one of the risks is potentially low birth weight. However, the risk of low birth weight from one of these medications is actually lower than the risk of untreated perinatal mood and anxiety disorder, or at least equivocal. So it's important to consider the risks of each decision that you're making, because choosing to do nothing is still choosing to do something. And just talking about risks of these medications in the SSRI, SNRI category, because people always want to know, what are they exposing their baby to? If you Google these drugs, you're probably going to read about neonatal adaptation syndrome, which you did talk about in one of your other podcasts. And that is a risk if you are on SSRI or SNRI in pregnancy. It affects up to 30% of pregnancies that are treated with one of these medications. And it's a self-limiting condition, typically occurs in the first 48 hours after baby's born. And babies often jittery, irritable. They may have difficulty initiating feeding, difficulty sleeping. And often this condition resolves with skin to skin and breastfeeding, and no intervention is needed, and there's no long-term effects. So although this kind of scary terminology of neonatal adaptation syndrome will come up on Google if you Google these medications, it's actually, it does matter. It is something that happens in the first 48 hours, and it can make it a bit hard to initiate breastfeeding. In the grand scheme of things, if it's protecting mom from a pervasive postpartum anxiety or depression, it might be okay. And I can't make that decision for every individual woman. I think everyone has to make that decision on their own. And those were the two sort of main risks that I just wanted to address, because of those are the ones that tend to come up when you.
No, it's so important. And I think the way you laid it out in terms of choosing to do nothing is still choosing some risk for your developing.
For your baby.
Exactly. One question that we had, and we see commonly in women who have a scheduled C-section, is how to cope with the anxiety of a coming, major surgery that you're going to be awake for. And do you have any tips around that?
Well, I can empathize with this, because I had an emergency C-section with my first birth, and then opted to go with a planned C-section for my second. And I come from a slightly different perspective, because I have been literally on the other side of the curtain assisting in C-section. So, I know what to expect in an elective C-section. But coming from the patient perspective, it still feels very scary when you think about, and it's almost scarier when you have time to think about the elective C-section than in an emergency setting where you just don't even really have time to process. So, it can be really scary thinking about the logistics of, okay, they're going to anesthetize me from the waist down. What is that going to feel like? And, they're opening my body, they're pulling out a baby. What, thinking about all of those very specifics, and what if something goes wrong? What if I get an infection? What if I bleed? And those are very scary questions. I ask myself those questions all the time. And I don't think you can make those questions go away or make those worries go away. But I do think that having some understanding of what to expect before you go in can help alleviate some of the worries. So even if you had a C-section before and it was an emergency or whatever it may be, if you have questions, if you have worries, take time with your care team to ask them to break down step by step what to expect from a C-section. So what time do I go? Like, what time do I get there? Where do I check in? Where do I go after that? What do I change into? You know, where does my partner sit when I'm having the spinal placed? What does the spinal feel like? How is the spinal different from an epidural? And, you know, just write out all the questions you have that are causing you to stay up at night and worry, and talk to your care team about it. They can walk you through, you know, what it smells like in an OR, where the anesthetist will be sitting, who else will be in the room. There's a lot of people in the room. You may not be expecting that.
There is a lot.
You know, and maybe just understanding some of the ins and outs of why a C-section is done and what it feels like, sounds like, smells like, can help take some of the unknown out of it. And anxiety is a lot about unknowns. So having a little bit of what to expect. And I think you guys just did a video on what to expect in a C-section.
Yeah, well, we did. I was thinking, because I was on call yesterday, and I was thinking that as I walked in, like because actually one of the patients was a very good friend of mine, and she gave me permission to be open about her having had her surgery, you know, and I was thinking, you know, I've had surgery myself too, and it's really scary being on the other side, but I know what to expect. I know what an OR looks like. And I was thinking how scary it could be for people who've never been in that environment before. So, but then I was too busy to talk about it, but Alicia hopped on and did. So
yeah.
that was good.
Yes, you had a busy call.
Yeah.
And you know, I think it's when you're a medical person, you can sometimes forget those details, but when you have a non-medical spouse, they sometimes ask those questions for you. And so kind of it was, my husband is not medical, and so he sometimes asked questions of me that made me think like, oh wow, that's probably how my patients feel, because they don't know what it's like to walk into an OR. They don't know what they're going to be wearing, or if they're allowed to wear their shoes or bring their phone in. So, you know, these are all really good questions, and no question is stupid. If you have a question and it would help to alleviate your anxiety to know the answer, please ask. Because we don't want you to go into your C-section more anxious than you need to be. Everyone's going to feel a bit anxious before surgery. It's surgery. But if we can help to minimize some of that, we would love to.
Yeah. We actually did a video of the operating room for our prenatal class, and like talked about what different like where the baby goes, where you go, just so people could like visualize, because a lot of people aren't expecting to have a C-section, right, with their first baby. I'm sure you weren't. That probably wasn't your plan. You know, but it can happen, so it's important to just know, you know, empower yourself with as much knowledge as you can.
Yes, definitely. Knowledge is power. So yeah, that would be my thought, is just arm yourself with knowledge.
Great. Thank you for answering that.
Yeah, no worries. So yeah, I think in terms of the only other thing I would say is worth exploring in terms of self-management of anxiety disorders is what Postpartum Support International often calls bibliotherapy. So that's basically just finding some good self-help books, or
that's my jam.
Books that kind of help guide you through your own psychoeducation, so you can learn more about why you're having the feelings you're feeling, and why you're behaving the way you are in response to those feelings. So I do have some links that I'm going to send you. There's one out of the BC Mental Health and Addictions, a self-guided anxiety and pregnancy little PDF, and it's free. So I've got that in the links I'm going to send you, as well as a book that's available on Amazon. It's a self-directed workbook for anxiety and pregnancy and postpartum.
Oh, very cool.
So I'll send you those and a few other books that I like, and you can share those with your listeners.
We will. Thank you.
Yeah. So I think that's everything I had on my notes specifically that I wanted to talk about. I did want to answer my own question.
Yes, I would love that.
So the first question I always ask, or encourage people to ask, is what was the best part of new motherhood? And so for me, the first time around, so I come from a background experience of recurrent pregnancy loss, which if you have experienced any pregnancy loss, you'll know that it's just very traumatizing to kind of have this sort of excitement of this new life coming into the world and to lose it. And that happened to me a number of times over. And so to finally have my baby, especially after a birth that didn't really go the way I had imagined it, and to have him in my arms and to feel him and to know that he was real and he was here and he was safe, it was probably one of the best moments of new motherhood. And the same thing happened with my second. It's just, you know, even though I kind of had a little bit of sense like, oh no, things will be okay now because I've had one, it can happen again. Still, you know, there's nothing as profound as actually seeing that baby and holding that baby, feeling the baby, smelling the baby, and knowing that they are there and they are okay. So that, as well as the newborn snuggles, which I have right now with an 8-week-old baby, just that, you know, lying on the couch and the little sighs and that sort of warm, damp breath on your chest and your neck. It's just so precious, and you don't realize how short it is. It ends all of a sudden. So that is really the best part, my favorite part of new mother. And then for me, and this will probably be echoed by so many women, the hardest part of new motherhood the first time around was breastfeeding. And again, this gobsmacked me because I had done 7 years of medical training. I had done a family medicine residency. I had answered women's questions on breastfeeding without ever having breastfed myself. And I'm sorry if I gave you information that just did not make you feel heard, because I didn't understand how hard it would be until I went through it. And I think this is true of everyone, is we just can't understand until it's us. But for me, with my firstborn, he was born quite jaundiced, and then he had quite significant weight loss in the first 48 hours. So there was a lot of stress in getting him fed, and my milk supply didn't come in, because that's often what happens when it's your first delivery. So I was having to pump like crazy just to get enough colostrum to get this baby fed, and we were having to supplement him formula, but he didn't like the bottle, so we were using spoons and cups, and it was just this production. And I was waking up every hour and a half overnight to pump, and then I ended up with this terrible engorgement and oversupply, blocked ducts, mastitis. It was just not at all what I expected. And thank goodness for lactation consultants. I had the support of one in particular lactation consultant who actually lives in my neighborhood, and bless her, she just took such good care of me. There was a time where I was trying to get my baby to latch. I could not get him to latch, and she said, call me anytime if you need something. And I called her, and she said, I'll be there in 15 minutes. And she came to the house. Like, just bless this woman. She's a rock star. If you live in my area, you know who I'm talking about. She is just a wonderful human. So breastfeeding can be really, really hard for everyone, even if you think you are very well armed with resources. So what I would say is just, if you are in the thick of it as a new mom and you're finding breastfeeding challenging, know that you are not alone. Breastfeeding is really hard for both you and for your baby. It's a motor skill that both of you have to learn, in addition to there being outside logistics like jaundice and weight loss that can make things more of a pressure cooker. So if you're struggling, get help. Don't hesitate to get help. If you are in an area, I know some of your followers had asked about what if you're in a rural area that doesn't have resources. If you are in one of those areas, there are lactation consultants that do virtual consults who will watch you breastfeed on a virtual format, and they will give you advice over your computer or over your phone. They can come into your living room and support you. So please just, I would actually strongly encourage every pregnant person to find a lactation consultant in their area, or find someone online who you think you would jive well with, and get their name, get their contact details, and maybe even do an initial sort of meet and greet before your baby is born, so that if things don't go well, there is someone that you can call that you are comfortable with. But don't let things linger on and let the anxiety build, and find yourself at 3 a.m. with a screaming baby that won't latch, feeling hopeless, and well, I'm just gonna quit breastfeeding. Which, if you want to quit breastfeeding, by all means, please do. But if you don't want to quit breastfeeding and you feel compelled to because of outside circumstances, that's not nice for anyone.
No, absolutely.
So if what you want is to continue breastfeeding, but you are feeling hopeless, please get help, because there is help there, and it can just make the world of difference.
Yeah. There's actually some great online courses too for breastfeeding, preparing for breastfeeding and stuff. There's a couple that we really like. And it's amazing. Like you were saying, the upside, like the PSI virtual support, and it's kind of, I wouldn't say it's an upside of COVID, is learning how many virtual resources have sort of popped up and can help isolated moms who were isolated before COVID because of geography.
Yeah, totally.
Yeah. Yeah.
So there's a silver lining. It's
Yeah.
not all bad.
Yeah, exactly.
2020 is not all bad.
Yeah, exactly. Mostly, but not all.
Yeah.
Yeah, that's great. Thanks for sharing your personal story. It's so important.
No worries. I think it's really important that we share our stories as much as we are comfortable. So
Yeah, I agree. And it's funny because I'm listening to you say, and for me, like if I answer those questions, the best thing is just the love. Like the love that you feel when you see that baby. It's a whole new level,
yeah.
right? Like I love my husband. Don't get me wrong. You might have heard him come in here and fumble around, glaring at him. But that love that you feel for your children, your heart, it's like your heart grows like the Grinch 10 times, right?
Yeah.
And it's just like I'm getting like tingly just thinking about it, right? And for me, breastfeeding was the hardest part too.
Yeah.
Absolutely, right? I had flattish nipples, not anymore. Now that I've had 3 children. But and he had a little tongue tie and pumping, cup feeding, nipple shield, you name it, right? And
oh yes, nipple shield, yes. In there too.
yeah, and it's funny actually. I'm now currently doing I am doing a lactation education course and I'm working towards getting certified because I think doing maternity care, it's so important.
Yes.
And a lot of lactation providers, unfortunately, aren't always covered by extended benefits, but I can do it as a physician.
Yeah.
It's something that I can provide my patients that will be covered by their health plan.
Yes.
So, because I'm so passionate and there's just, you're right, like even through our medical training, I was running on a mom yesterday, it was 12 hours postpartum, and the medical student was like, well, what about a nipple shield? And I was like, what about we help her with her latch, right? And it's just like, we really have to go back to basics when we're learning about breastfeeding. And there's just so much to learn in medical school that we don't have time. Like you said, like,
yeah,
even in family.
Yeah, it's no one's fault. It's just,
yeah,
we can't learn every single thing.
Yeah. That's why we're here.
Yeah.
Exactly. Yeah. Exactly. Well, thank you so much for taking the time to chat with me.
Thanks for having me. Yeah.
It was awesome. And I really do look forward to doing a few more podcasts with you. So we'll link everything that we covered in the show notes below in terms of some resources that are available for people and the previous podcast that we did about nests, as well as Alicia did one with one of our local perinatal psychiatrists about postpartum stuff. Pip and I will hopefully do a few more podcasts maybe on insomnia and pregnancy and postpartum.
Yes,
that is
great.
Something we get huge questions about, as well as perinatal mood and anxiety disorders for the partners and the father.
Yeah.
Because definitely. I think they're under-recognized,
Absolutely.
Treated. Awesome. Okay. Well, thank you so much for your time. Now please go and snuggle hopefully maybe your baby's sleeping. It's 9 p.m.
He didn't really want to go to bed this evening, but he is sleeping now. I haven't heard anything. So,
okay. Yeah. So it's your turn to go sleep, right?
Yeah, exactly. Yeah.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information. Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.